Hello everyone, we are group 105 of Social and Professional Issues in Computing course, and we are here to talk about our research topic, which is the popularity of e-health care for pandemic management in Bangladesh. In this pandemic situation, providing and getting medical services physically has become a major challenge now. COVID-19, being an infectious disease, puts non-COVID-19 patients having other health issues at risk. Therefore, the need for telemedicine as a precaution to self-protection is necessary now more than ever. So we have done a research to find out the current status of the popularity of telemedicine. For this research, we have done a survey on a sample population of 267 people to find out the main drivers and barriers of telemedicine and characteristics of the users, among whom the service is popular. After analyzing their responses, we have found that the strengths of telemedicine are minimized travel cost and efforts, less time taken to get an appointment with a medical expert, getting efficient treatment, minimizing the risk factors of COVID-19, being able to get service at emergency situation. These are internal drivers of telemedicine that are encouraging people more to adopt this service during COVID-19, and the external drivers of telemedicine that can increase the popularity of telemedicine by creating new opportunities are rural people can be benefited during this pandemic by adopting the service. Telemedicine developing their services now more than before. Lower cost of smart devices. Government funds and initiatives for proper development of telemedicine. The internal and external, both drivers, affects the popularity of telemedicine positively during this crisis moment.
On the other hand, the weakness of the service are while using telemedicine, some people feelings that their privacy is at risk, encountering technical error while taking the service. Telemedicine is not being able to meet patients' need properly, and inadequate medical devices to support telemedicine service. These are the internal barriers of telemedicine that are affecting the adoption among people negatively even in this crisis situation. And the external barriers are not having enough improvement done in the telemedicine sectors. People's dependency on the traditional medical services, people lacking in technical skills and knowledge, some people being unable to afford the cost of telemedicine and slow internet speed in remote areas. These are the barriers of telemedicine, which is affecting the popularity of the telemedicine services negatively. Our another objective was to find out the characteristics of telemedicine users. By profiling the users, we have found that the people who are middle-aged, living in city area, people having a specific job, having an income level around 30,000, familiar with technology, and spends good amount of time on their electronic devices are most likely to adopt the service. We also took the overall rating on the performance of telemedicine from the telemedicine users and non-users. But in both cases, the average rating was 3 out of 5. So we say that the service is still not as popular as it should be even in this crisis situation. The popularity is at moderate level. Also, there are lots of research done on telemedicine in Bangladesh. By analyzing the factors with before and during the pandemic, we can conclude that the development of the telemedicine or e-health services is still at static rate. Several factors have still not been improved with time.